Hello. Today I'd like to introduce you to my friend and colleague, Dr. Naveed Akhtar, who is an integrative health physician and GP like myself. He is senior partner at his practice in Chigwell in Essex. He has 19 years of experience in medicine and has many qualifications, including an honours degree in neuroscience, being a member of the Royal College of Surgeons, as well as the Royal College of General Practitioners. He is an NLP and hypnosis trainer and educational trainer in minor surgery at the RCGP, and is also a medical acupuncturist. He has co-authored the chapter with myself on integrated health in the College of Medicine's manifesto, Hope for the Future, being an active council member of the College of Medicine, as well as the Integrated Health Alliance.
Thank you, Toh, for that introduction. And now I'd like to introduce my dear friend, Toh Wong, who, like myself, is a GP and co-organizer of the Integrative Health Convention. He has been a GP since 2006 and has various qualifications in conventional Western medicine, including an honours degree in medicine from the University of Leicester, as well as a certificate in clinical education from the University of Exeter. He has been a GP trainer for almost 10 years, as well as a tutor at Exeter Medical School for many years. He practices acupuncture in his practice on a daily basis and uses his skills as an NLP and hypnosis trainer in his full-time clinical practice in his surgery just outside Exeter, where he is senior partner. He has interests in longevity medicine, integrative health, fasting, and meditation.
Thank you for that introduction, Naveed. I thought that today we'd give an outline of what to expect at our talk on Friday, the 11th of February, 2022 at the Integrative Health Convention virtual event.
So, Toh, we're going to discuss our approach to integrative health, which drives us, the most common integrative approaches that we use, and the most common conditions that we treat integratively. More importantly, we will talk about the take-home things that you can do. We're confident that this will make a difference, because if we can use these interventions in a 10-minute consultation, so can you. I thought I'd clarify what we mean by integrative health, which is an approach taking into account conventional medicine, self-care, and complementary therapy approaches. I truly believe that this is a future of medicine, the ability to synthesize different modalities to improve the outcome for the patient.
That's right, Naveed. We'll break down our years of experience in medicine as busy GPs, using approaches like acupuncture, hypnosis, and NLP. NLP being the use of language to make therapies more effective. We also use psychological techniques from the latest in behavioral science, and we'll discuss some of our commonly recommended foods, supplements, diets, based on the latest research in longevity science and integrative health practice from all over the world. Our talk will include things like the microbiome, longevity approaches, and managing common conditions that you may have come across, like headaches, chronic pain, IBS, and repetitive strain injuries. It'll include a brief highlight of how to use the principles of NLP and hypnosis and all the techniques that we teach on our courses.
Toh, I think we should give the people who have taken the time to listen to us today a sneak peek of what to expect. I think we can do this by talking about one of the common conditions that we treat. Should we talk about the management of headaches?
Excellent idea, Naveed. Because I think the approach we have is very different from other people's approaches. Conventionally in medicine, I'd say we all approach headaches about the same way. We take a history, exclude red flags, which may indicate a brain tumor or bleed in the brain, do someone's blood pressure, examine their central nervous system. There are many, many different types of headaches, but the most common ones we see are tension type headaches, migraines, and sometimes cluster headaches. We then offer people drugs to treat the headache as the headaches come on. And then we can then consider drugs to prevent headaches. So preventive treatments are with drugs like beta blockers, which you might have heard of, or second line treatments like topiramate, which are anti-epileptic drugs. Fortunately, I have almost never had to resort to second line topiramate as an agent to prevent headaches. So anyway, let me explain my approach that's different. So once all the usual examination is normal and I've taken good history, I focus a lot on the distribution of the pain. The reason for this is just like in cardiac pain, where a fist to the chest is a reliable indicator that this pain is of a heart or cardiac origin, where someone points and the radiation to the left arm might indicate that someone has a heart pain. Just as the same, where the pain of the distribution of pain of the headache gives an idea of where the pain could be coming from. For example, pain is often described for headaches in the occiput, so the back of the head, radiating to the temporal areas, sometimes even described as behind the eyes. And this tells me that the headaches could well originate from the trapezius trigger point, which, or in traditional Chinese medicine, the gallbladder 21 area of the trapezius muscle. So this is in the middle, the midpoint between the C7 spinous process, so the bone at the back of your neck, to the tip of the acromion, which is the tip of the shoulder here. So right in the middle is this trigger point that we can feel by palpating, by feeling perpendicularly to the muscle. And sometimes you can press on it and you can reproduce this pain, thus proving the hypothesis of where this pain is originating. Actually, the vast majority of headaches do originate from this area. And sometimes, occasionally, the pain is more in the ear or the angle of the jaw. And if this is the case, then often this indicates that the pain may come from the sternocleidomastoid muscle, which is this muscle here. However, this is much less common. So the other thing I would do is I would look at the posture of the person and look for undue tension in the shoulders and the trapezius muscle, which is this muscle here. And I'd feel the muscles around the neck because, and see how things how tense things are. You can learn a lot by feeling and by touch and by palpation. Many doctors don't learn to feel and to palpate and to spend long enough touching the patient and examining them. And if you don't examine someone, then you don't get the experience. So in the case of headaches, I would say the treatment with acupuncture is almost always useful. Now, acupuncture is advocated by NICE in their guidance for headaches and in the new chronic pain guidance issued just in 2021. And I perform acupuncture in a standard 10-minute GP appointment. And if they have a headache at the time, it tends to almost instantly relieve and provide longer lasting relief. It tends to reduce the severity and the frequency of headaches. So you get less severe headaches if you do get headaches, and you don't get as many. So less severe and less often. And I may have to see the patient return for maybe 2 or 3 times usually, or sometimes not at all. And then sometimes they come back for a maintenance dose every so often. But I would say, a few times is not as often as seeing someone over and over again for medication reviews if you put them on tablets over and over again. So then while I'm examining the patient, while I'm doing the acupuncture, I often discuss their stresses, their strains, their sleeping habits, their diet, their weight, their posture. And I can do this all while I'm examining the patient, while I'm treating the patient. And we make plans together how these things could improve. Well, that's my integrative approach, Naveed. What about you? Would you add anything to that?
Well, my approach will be very similar to what you've described already, Toh. I mean, sometimes I might organize a brain MRI scan, to rule out any intracranial pathology, having gone through the steps that you've described already. And often this MRI scan is normal. But even having gone through the entire management as you've described, there's still some patients who continue to suffer with headaches. And in those instances, I might use NLP or hypnosis techniques as an option if they're not responding. as communication with the unconscious mind in a relaxed state can often deal with many triggers for migraines or headaches.
I do agree, Naveed. And like you said, we sometimes need investigations if things aren't getting better. A patient of mine who wasn't getting better recently, I ordered a scan and we suddenly found a bleed in the brain, but then he had certain things in his history which sort of worried me. And the fact that he didn't respond to initial treatments with the acupuncture, again, these things raise alarm bells. And that's why an experienced clinician often helps in this approach. But the thing about us is we have an openness to using an integrative approach, to using complementary therapies, to using other ways to help people. And our attention is firmly on the patient's well-being and health at its heart. And we also base our decisions on avoiding side effects of acute and long-term medication. And I do believe patients do get a much better service. I'm not saying that none of my patients use any medication, but certainly very few of my patients are on escalating doses of medication that cause them harm or to function less than optimally in the world.
You're absolutely right. I mean, I've had 4 or 5 patients in the last few years who've suffered tremendously with headaches. And a number of them have had headaches for going back 30 years. They'd seen the neurologist, they'd had a normal brain MRI scan, and over the years they've just been put on higher and higher dose of medication, some of whom were then experiencing side effects of these medications, and having gone down the approach that we've described already, and then doing NLP and using some hypnosis techniques. In those few people that I've worked on, we've successfully managed to eliminate their headaches completely. And these are in patients who were suffering with migraines almost on a daily basis. So during our talk, we will be discussing different ways that we've approached a variety of medical conditions in an integrated way, different ways to help our patients without the need to rely on prescription medication.
That's right. We'll be discussing techniques that have taken us years to learn and perfect. And now we've been able to effectively use these in a 10-minute consultation. These are techniques we teach to doctors and other healthcare professionals at our surgeries and our courses.
So the virtual Integrative Health Convention will be broadcast on the 11th of February, 2022. For those of you who don't have a ticket yet, Toh, can you let everyone know how they can get hold of a ticket, please?
Well, of course, tickets are now available on our websites at integrativehealthconvention.co.uk, and simply click on the link and get access to an early bird ticket offer. Now, we've tried to make this very reasonable for you so that everyone can attend and everyone can learn about these integrative health approaches. And we've got a stellar cast this year. So please, you need a ticket to come. Please do come and join us. I hope you've enjoyed this talk, everyone. We're going to be releasing more interviews with our speakers, so please click and subscribe so you won't miss out.
If you've liked this video, please give us a thumbs up and help us to spread the word and share this video.